I'm Debbie Ritchie. My teaching project is to assist families with patients nearing death, what signs to look for, how to communicate with their loved one, and a few simple ways to make them more comfortable. Many times families will ask me, how will I know when death is near? There are some physical signs that our bodies go through when death is approaching. Here's a little handout that goes over some of those signs. Our bodies will develop physical changes up to 2 weeks before death occurs. You may notice that your loved one is sleeping more often. Let them sleep. Their body is beginning to shut down and they just need to be able to sleep as needed. Your loved one's body temperature will also change. You may notice that their skin becomes cool to touch. Sometimes they become very warm and sweaty also. So you want to change their linen, change their pillowcase, because that will make them more comfortable. You may also notice the pale color of their skin, and then as death nears, they will also become cool to touch, and they develop some mottling. And this is a picture of the arm as it changes into the mottling stage. This is just because the blood is pooling into the middle of the chest to the vital organs, and it doesn't need to circulate to the arms and legs. And this does not make your loved one feel uncomfortable at all. You may also notice that your loved one is becoming more restless in the days close to dying. In hospice, we will use Ativan, and we'll give that under their tongue, and that will help them become a little bit more relaxed. And also position changes will help them become more comfortable. Oftentimes, family members will comment that their loved ones are hallucinating. They're talking to people that aren't present in the room, or perhaps sometimes they even talk to loved ones who have already passed away. And this is a normal process in dying. So just I reassure them not to be alarmed if they're talking to people who aren't in the room. One of the biggest concerns for families of the dying person is decreased fluid and food intake. In many cultures, food symbolizes our love for our family members. And when our loved one is near death, they don't require as much food and water as a healthy person. The bodies can't digest the food, and it ends up just sitting in their stomach, and they become very nauseated and uncomfortable with that. So I encourage families to just give small amounts of food, try to give them foods that they like, and just be aware that because their swallowing reflex isn't as good as it used to be, they may choke on that. So you want to make sure their head of the bed is up when you're feeding them. Many family members talk about a death rattle. This is accumulation of secretions in the back of their throat as well as in their lungs. The ability to cough decreases as we near death, so they're unable to clear those secretions, and you can hear a rattling sound in the back of their throat. Positioning your loved one and using medicines like Robenol and scopolamine will help dry up those secretions. Changes in bowel and bladder function also occur as death approaches. They may lose control of their urine and stool. Their urine output will decrease. The color of the urine will change. It'll become more brown, darker color, and it can have a stronger odor to it. And also the amount will be less. You can use adult diapers, or you can put a towel underneath them to catch any urine or stool that they may release, and just make sure that you check them and clean them often. You can put a skin barrier on to help prevent skin breakdown. The breathing pattern also changes as death approaches, and you may also notice that their heart rate is irregular. Your loved one can experience fast and shallow breathing, and then they can have periods where they may not take a breath for up to 50 seconds. And then when they do breathe again, it will be a deep sigh. And again, this is a normal part of the dying process. You may also notice that their heart rate is fast and their pulse could be thready, and you may not even be able to feel the pulse in their hands. It is important that you let your loved one know that you're there. And this brings up my next topic, which is communicating to your loved one that is nearing death. Many people fear talking with their loved ones because they're afraid of their own mortality or because they just don't know how to talk with their loved one. There are a few things that I want you to remember. One, be honest with your loved one, especially when they're more alert. You want to explain your fears, tell them that you will have a sense of loss, but also reassure your loved one that it is okay for them to pass away. You will be okay. If you can't find words, you don't always have to talk with your loved one, but just sitting there in silence, touching them is an important part of communicating. Maintain eye contact. This way, your loved one will know that you really truly are listening to what they're saying and you're paying attention. Your loved one may have periods where they are very talkative or they become withdrawn. Don't feel like your loved one is upset with you. Again, this is just part of them trying to deal with their impending death. And remember, silence is a good thing. When they are nearing death and they may not be able to communicate with you, just sit in the room, touch them, and reflect on the good parts, the memories, the happy times that you can share with them. They will hear you. Lastly, I would like to discuss some simple comfort measures. I went over some of them earlier. Position changing is very important. You can support their arms or legs on pillows. This helps so that they're not pulling down and being weighted. Put a blanket, a soft blanket between their legs if you're having them on their side. That way the bony prominences of their knees aren't touching and rubbing together. Change their linen because many times they are perspiring and their linens will become wet, and it's nice just to have dry sheets to lay on or a dry pillowcase. Mouth care is also important. If you don't have a toothad, that's a sponge on a stick, you can get a washcloth. Make it a soft washcloth, dip it in some ice water, and then just gently put the cloth over your finger and then wipe in the inside of their mouth. And then you want to apply any kind of lip balm, chapstick, anything to help keep their lips moist. In hospice, a lot of the medicines that we use are morphine, Ativan, Robenal. And because our patients have a difficult time swallowing, we will give a lot of their medicines under their tongue. That area is very vascular, so the medicine will absorb easily there, and you don't have to worry about them choking when they're taking their medicines. Importantly, if you have questions, if you're not sure about something, you can always call your loved one's nurse. They are there 24 hours a day, and they will be able to give you some reassurance. In closing, your loved one will show physical signs when death is near. Nobody can give you an exact time when death will occur. During your loved one's final days, communication is important. You don't have to always speak. Your presence is important. There are simple things you can do to help your loved one maintain comfort. Finally, know that you are not alone during this journey. Your nurse, physician, spiritual advisor, family and friends are near to support you and your loved one. Thank you for your time.